Hi everybody, Dr. Debunk here, doing another educational video for my patients and all who are interested. Um, Missed last week, but I'm going to do some practicals, some stuff today. Um, I had started a little series on the scientific principles and attributes of human health, the 10 categories of scientific principles that determine the speed of aging and your health. I'll get back to that. I did three of them. I don't forget where I left off. Oh, genetics. I did a genetics one last time, but we'll come back to that. I'll either do the infectious theory of aging or the pollution, probably infectious. But today, I'm going to do four things. This video will cover vitamin C and vitamin D. Patients are always asking me about how you take vitamins and nutrients and minerals, and it's a vast field. It's still haven't figured out how to quite do it practically myself. Um, but vitamin C and vitamin D, especially vitamin D, has been more recently in eyes of the public in medicine. But we'll start with vitamin C because it's a big one people like to supplement with. I think it's a good idea. I wish I was more regular at it, but there is an optimal way to take vitamin C, I think, based on the science. And that's what we're going to talk about. Just as a quick over review, vitamin C. Vitamins are essential nutrients. They are substances that we can't make, but they're essential for us to survive. So vitamin C has to do with a number of metabolic functions: skin, hair, collagen. Um, it's also an antioxidant, but that's a secondary job. You can use it artificially at high doses to be an antioxidant. Um, and then people have supplemented forever, and there's the whole cold and flu thing. Vitamin C, for some people, reduces the intensity of a cold. I've really never seen any of the studies show it prevents it. People say it does. Maybe it does, but as we learned from COVID, there's a lot of genetic typing here. Depending on your genetic makeup, a lot of things help you or don't help you. And someday we'll understand that better. Um, but some people taking high dose vitamin C at the first onset of a cold, that can help them reduce how long you have it, maybe even stop it as it's starting out. And everyone kind of aware of that. And we'll talk about how to do that. And then the other thing is vitamin C and cancer. That's been a topic thrown around for 60 years. That's the whole Linus Pauling thing and his belief that you could cure cancer with it, which is partially true. It is a treatment. And so the connection is that vitamin C, or the issue with vitamin C and cancer, is that if you took enough vitamin C, you could cure cancer. Well, how it's partially true is vitamin C at high enough doses in your bloodstream does either inhibit or kill cancer cells. That's absolute science. But can you take enough by itself to cure cancer? That's where, I've looked through the databases to see if there's any studies on that. And there is. It's used as an adjunct. And this is just, you got to take this with a grain of salt because a whole lot more science would have to be done to answer the question, could you take enough vitamin C IV therapy to cure cancer by itself? Maybe, but and so there are places that use vitamin C in conjunction with chemotherapy and radiation and other cancer treating stuff. There are some studies you can find that it's an aid. It seems to me that you could reduce the amount of chemo you could take with vitamin C, but you have to do it IV. You can't take enough orally to get a blood level high enough to do anything. And I won't go into the details of that, but there is science to support all that. But the main thing is long-term having great vitamin C levels to promote your health, which it does. It seems to affect the immune system and the connective tissue, as I mentioned already. And so with that, there are a couple different ways to take it. So taking it, we'll start with taking it for long-term health. How do you maintain optimal vitamin C levels? Well, we don't really know what that is because we've never done tissue studies. There's never been tissue studies on most anything, but a little bit. Vitamin D, we'll talk about that next. But so vitamin C, you have to understand how it works in our body, how long it stays in our blood once we take it, how much do you need to get in the blood. And so the classical way of taking a single daily dose of vitamin C is kind of a joke because it has a half-hour half-life. What that means is 50% of it disappears every 30 minutes. So that means in 5 half-lives, it's gone. So if you take a dose, 1,000 milligrams, 10,000 milligrams, it's all effectively gone in 2.5 hours. So that doesn't keep enough vitamin C in your blood long enough to feed the cells that actually need that. And in order to understand that, you'd have to watch the circulatory theory of aging video I do, which is it's on YouTube and it's on Rumble, but and I won't get into that. But so you have to redose frequently to maintain a high blood level. So every nutrient you need has to stay in your blood a certain amount of time to get into the cells of your body to do the effect. And so something like zinc, which has a half-life of like 5 days or something like that. I mean, you can take it once a day. Vitamin D has a 24 to 48 hour half-life. So you can take that once a day. But vitamin C with a 30-minute half-life. So here's what I believe is the optimal way. Instead of taking 1,000 milligrams every day for 7 days, a week, you take it every day, which is very popular, and that's good. You could take 2,000. Usually people, to get side effects, have to take 10,000 milligrams a day to start getting diarrhea, which is what it'll give you. And so if we said 7,000 a week is ideal, well, I think a better way to do it, it's how I do it, is you take 500 to 1,000 milligrams every 30 minutes for half a day. So, and I think the 1,000 is better. So if you take 1,000 milligrams and then every half hour take another 1,000, you do that for like 3.5, 4 hours, 1 day a week. Now, why do that? Because the cells of your body that need the most vitamin C are the ones at the terminal capillary beds. They're the last, those capillary beds are the last supermarkets in a long chain of trucks on the road trying to feed the supermarkets. And again, you have to see the video to understand that. But the bottom line is, the cells of your body that are the most deficient need to have the high, you need to achieve high blood levels for a longer period of time in order to drive the vitamin C all the way down there. If we said there was 100,000 houses that needed water, and the water truck semi filled up with 1-gallon bottles of water starts unloading them as it's driving from city to city to city, well, it's finally going to run out. So you have to keep putting trucks on the road. And so if you had to do this in 1 day, then you'd have to put 1,000 trucks on the road or whatever to be able to get to all 100,000 homes. And the trucks would stop, and then the next truck at the next stop at the next stop. And so that's what we're trying to do here. Because 1,000 milligram vitamin C in 2.5 hours is gone. Well, the cells that need it the most will never get it. So if you do 1,000 milligrams every half an hour for 3.5 hours, well, that's 7,000 milligrams. And for that entire time, the blood level of vitamin C stays high. Once you get up, once you've got in about 2 hours worth of pills, 4,000 milligrams, now you keep peaking that level every time you redose every half hour. And that way, you're driving the vitamin C way downstream to the cells that need it the most. And so that's how I think you should take vitamin C. And you can do that 1 or 2 days a week. I mean, you could probably do it every day forever, but you'd just be peeing out vitamin C like crazy. But 1 or 2 days a week, depending on what you feel like doing. I wish there was an objective answer for that. But blood tests wouldn't be that helpful because we'd have to do tissue analysis. We've never done it. So anyway, so vitamin C, and in the end, I'll recap and go over it again. So have a pen, and then at the end, you can write it all down. So next subject, vitamin D, and I'm just doing it because, well, this has been 10 minutes, so this will probably be a 20-minute video. So vitamin D is a vitamin that is the most well-studied vitamin in the history of medicine. We're not nutritionists. We don't study vitamins for health and wellness. But 17, 18 years ago, a bunch of stuff happened where we found vitamin D deficiencies, and I believe it was in young women with cardiac arrhythmias. And the only thing we could find wrong with them to explain these arrhythmias was there was basically no vitamin D in their blood, which is like almost impossible. But that means that the cells of their body were so hungry for vitamin D that they were sucking it down to a level that was so low. And when they kept giving progressive amounts of vitamin C until they gave massive amounts, they started to see that these cardiac arrhythmias would go away. And then they began to realize that a small amount of virtually all problems, or many, many common non-hospital problems, could be fixed with vitamin D. Less than 1%, half to 1% of people, their stomach problems would go away, their headaches would go away, their skin rashes would go away, their menstrual irregularities would go away. And so it started a flurry of research that continues to this day. And to not go through all that, so now we've done thousands of vitamin C studies worldwide in medicine so that we know how to give it, the dosing, what conditions it helps, what's the frequency, what's the percentage chance of success. It's just an endless trove of data. And so I'm just going to summarize it for you and not bore you with all these details. And so pretty much any condition medically has a possibility of being affected by vitamin D. And how it affects it is you have to go from deficiency down here to sufficiency up here, or optimal. And so, as I've mentioned in other videos, the goal for human health is to be optimal, have optimal motivation, energy, endurance, and strength. So vitamin D levels can be anywhere from deficient to optimal, and that plays a role in your ability to have optimal health. And so now we know what optimal is. Vitamin D is one of the few vitamins that we understand what optimal blood levels are, which kind of guarantee that you'll have tissue levels that are optimal too. And so basically how it works is 1% or less of conditions, from skin rashes to allergies to whatever, headaches, can be reduced or eliminated by going from deficient vitamin D to optimal. And that's what 18 years of research has showed. And so overall, that's a bad yield rate, obviously. If you're saying 1 in 100 to 1 in 200 people will turn around this condition with mega vitamin D therapy, well, that wouldn't be a very good drug therapy. Well, we're talking about a vitamin, so who cares? So because vitamin D is a vitamin and it's cheap, we can use it to treat conditions like this, pretty much anything, but then also use it as a nutrient to have maximum levels to ensure our health. And so what that means is everybody needs to do vitamin D therapy. Everybody needs to do megadose therapy for 6 weeks or so, and then do a long-term maintenance therapy and take it for life. And it's pretty easy to do, which we'll get to that in a second. And the science has evolved because vitamin D has always been associated with bone health and preventing osteoporosis, along with this cousin vitamin K, and many other things go in with it to prevent, the whole bone decay thing and osteoporosis. And I won't get into the details of that, but you have what started to happen is 18 years ago, the reality that vitamin D affected other bodily systems, in other words, it had more metabolic effects than we ever thought of, started this whole journey of studying it obsessively, because again, we're not nutritionists as doctors, but because we couldn't explain how it could affect headaches or menstrual irregularities, they just kept digging. And so what it finally led to, and uh, it's about a couple years ago now, the reality that there's some kind of energy connection. Vitamin D acts as an energy substrate, and and I haven't really looked again since 2 years ago. But that's kind of a game changer. Understanding that vitamin D could affect energy levels, then that means it affects every organ in the body, which means it could explain partially how these conditions are affected by it. So if your skin is a little low in vitamin D and you seem to be getting skin rashes that no one can really officially diagnose, and then you take a ton of vitamin D and it goes away, oh, because it altered the energy levels of skin cells and made them more healthy, and it allowed your body to fix it naturally. And we see this with virtually everything from cardiac arrhythmias to intestinal problems. Mhm. And so that is probably the connection. There's an energy metabolic thing going on here. And they'll probably keep studying it, figuring it out. But for clinical practice for someone like me, then well, that just means okay, everybody's got to do this. And because we've tried so many different ways of using it, um, that we've kind of figured out an optimal level. Now, doctors, because we're lazy like everybody else, found a way to just give people a once a week big old fat pill of vitamin D, which is not a very effective way to do it. It does work. That became the standard. And because we've gone through so many blood testing, we don't really need to do them anymore. I mean, I've done thousands of vitamin D tests. And so you start to see a trend and a pattern of how to do it. Now, the other thing, besides the health and minor conditions, there seemed to be a relationship with treating COVID. And by the end of the COVID crisis, which was pretty much done by January of 22, we realized that people could take massive doses of vitamin D. Stuff that we've done in nursing homes, 200,000 units in a butt shot and an intramuscular shot. Even more, there were some places that were giving 1 million units over a few days. Um, and the early studies suggested that it was beneficial, that if you were really sick with COVID, or to prevent from getting really sick, you could take massive amounts of vitamin D. And we can tolerate massive amounts. Now, vitamin D is the opposite of vitamin C. It has a very long half-life. It's a fat-soluble vitamin, not water-soluble. So the rules are totally opposite and different. But anyway, there was a whole COVID thing, and I'll do more on this. I haven't looked at any further COVID research, which is still going on, because it's applicable for the future when the next pandemic hits. Vitamin D therapy will be definitely something that we will do. And I'll probably give, butt shots of vitamin D to patients. If not, you just take massive oral doses. It takes a lot to overdose. Most vitamins and minerals, we have what's called LD50 information. What does that mean? What's the 50% lethal dose? LD, lethal dose 50. That means how much you have to take of a substance to kill 50% of the people that are doing this. And it's a lot for vitamin D. If I remember, you can't quote me on this, but I think you have to take 200,000 units, IUs, international units, every day for 3 to 4 months, and then you'll overdose and get really sick. So that's a ton. You'd have to eat half a bottle every day for months. So it's not even close the amounts we're using. But anyway, so the dose that I've come to use, which I think is the most practical way to use vitamin D. And so let me back up. Everybody should do high dose vitamin D therapy once, and then take it every week forever to maintain optimal levels. So if you don't take it for months and months, then you would want to redose at a loading dose, take it every day for 3 or 4 weeks. But the first time, it's ideal to do 6. Why? Because then you don't have to do blood tests. You can do them in the end if you want, but I've done so many that 99% of people will be sufficient, optimal, if they do this. So what's the protocol? So men should take 30,000 IUs every day for 6 weeks. Women should take 25,000 IUs every day for 6 weeks. and then you'll no longer be deficient. You'll be sufficient. And then you take it 2 days a week forever, Saturday, Sunday, always together in a row. And that will keep your blood level high enough to constantly feed your tissues a great level, basically 4 days a week. And it'll keep you optimal. And like I said, I've done hundreds of blood tests to show this. And then it's cheap. I mean, a bottle of 400 vitamin Ds, the 5,000 units, I'll come back to that, will cost you $22 or something for almost a year. So it's like, at the very most, $2 a year, $2 a month. Can you afford $2 a month? I think so. And the benefits can be reaching, because if you have a nagging medical problem that can't be fully affected or fixed by doctors, vitamin D may reduce it or get rid of it. And so that's pretty much it for that. So let me review. So if you have your pen, you want to write this down. With vitamin D, you do, and when you buy a vitamin, try to get one that's USP verified. That's the main lab, United Pharmacopoeia. There's other ones called consolidated labs. Then there's underwritten labs. But there should be the little symbol of an outside checker, that verifies the dose and purity. And many different brands are doing it now. And so the 5,000, they might have 10,000 IU capsules, but the stronger ones are 5,000. And the price is almost the same whether you get a 1,000 or a 5,000. But you get the 5,000s, and women, you take 5 at once. They're little teeny gel caps. You can throw 5 in your mouth, suck them down with food. Always with food. And it can be 2 bites, literally. You do that every day for 6 weeks. And then you do it on Saturday and Sunday, or whatever 2 days in a row you're going to remember. The same amount. It's always the same amount. 25,000 for women, or 5 of the capsules, and 6 for men, 30,000. And you do it, every day for 6 weeks, and then forever on 2 days. And that's how you dose it. And it's easy. You can throw it in with other routine of whatever else you're doing. And so now to jump back to vitamin C, that's the opposite. Write down. You do 500 to 1,000 milligrams every half an hour for 7 or 8 doses. I think 1,000 milligrams is better. And you do 1,000 every hour, every half an hour, for 3.5 hours to get 7,000 milligrams. And that is the best way to do it. And the same thing, try to find vitamin C. 1,000 and 500 milligrams are the most common tablet or capsule form. Now, vitamin C would probably be better. Well, maybe better. Take it sublingual where you do a chewable vitamin C. Vitamin C seems to be absorbed all the way through. But some people, if you take 1,000 milligrams times 7 over 3.5 hours, that might bug your stomach. But if you do the chewables, you chew them up, suck on them for a while, and you kind of do that for the whole morning or the whole afternoon. So you can try both ways. But I think those 2 ways are the best way to do it. And so that's kind of it for both vitamin C and vitamin D. The next videos coming up will be on iodine and magnesium. I'm Dr. Debunk. Thanks for watching.